Assalamu alaikum. As all of you are here after reading the title of this video, so here we shall discuss about uh, the first year MBBS. The major objectives of this video are: number one, to know the difference between annual and modular system of UHS. Number two, to know which books to follow, what are the UHS recommended books, and number three, how to study in first year MBBS, as there is a bit, or I must say there is a big difference between your FSC MD and this first year MBBS. Okay, so congratulations first of all for getting admission in MBBS. All of you are got have got admission in MBBS. It doesn't matter that either you're a student of private or government sector, you all are standing here. Just look at this picture. This picture doesn't mean, it is not showing that the race of marks and competition and jealousy has again begun. It shows that you all are standing here. You all are standing here. It doesn't matter you are a private sector or public sector student, or you are a roll number one of government sector and or last roll number of private sector. The thing to be noticed here is that this track. The thing to be noticed here is this track that you all have to follow. This track here actually is your syllabus of first year MBBS, or your journey to first year MBBS. Okay, you will see your fellows, you will see the students who will cover this track, or who will cover the syllabus of first year in just first 2 to 3 months of first year MBBS. Okay, don't be panic, you can also cover it. You can even cover it in your last 2 or 3 months, just before prof, just before appearing in your prof examination. But I'm not saying here that you have to do this, you are not supposed to do this. I'm just saying that you can do this. Okay, here's a difference between you can do this and you have to do this. I am saying that you can do this, but you don't have to do this. You have to cover your syllabus, you have to stick this path, you don't need to sleep. Okay, don't and one more thing, that don't listen others who are saying that why you got admission here, why you got admission in MBBS, why you got admission in this medical college, in this particular medical college. The thing is that you have come, you have to do it now. So you just have to stick to this path, and you have to work hard, because Allah has said कि इंसान के लिए वही कुछ है जिसके लिए वो कोशिश करता है. So you have to do, you have to make that attempt in order to achieve your desired results. all of you all of you have to reach a single destination, but this is a type of race where a coordination among all of these are needed. Okay, normally if we consider it a normal or formal race, there is even no cooperation among all of them, they are running in their own path. But in MBBS, this is a type of race, or this is, I must not say this is a race, this is a journey where cooperation among all of these participants is needed. Okay, okay, number two objective here is that to know the difference between annual and modular system. Okay, we will take a just brief review it. In annual system, which was followed previously, and modular system, which has been introduced roughly in 2023. In annual system, there was no link between the subjects. There were three major subjects: anatomy, physiology, and biochemistry. Here are the same, but this is your modular system and this is your annual system. Here the subjects are the same, major subjects are the same, but here are some minor subjects as well, like pharmacology, like pathology and BS. And number two thing is that there was no clinical exposure. Okay, there was no interaction among the students until their third year in annual system. But in the case of modular system, you have clinical rotation or clinical interaction with the patients, you have hospital exposure from the very beginning. Number three is that there was a theory based paper in your annual exam, and there were just three papers. Here modular system also contains three papers, but these were mainly of theory based papers. And in annual examination, there were total 600 marks, and in modular system, there are total 1000 marks. In annual system, the students were used to cover their Islamic and Pak study in second year MBBS, but in modular system, you have to cover even these subjects, these two subjects, Islamic and Pak study, in your first year. Okay, so in annual system there was very less percentage of internal assessment, but in the case of the modular system there is a comparatively larger percentage of internal assessment, so you cannot ignore your university exams here. Okay, so let's come towards our next objective, that is how to study in first year MBBS. Number one thing is that you have to follow your recommended books. I will tell at the end of this video. If it is not longer, then I will tell you inshallah at the end of this video that which books you have to follow in your first year number. Okay, write down the steps, note down the steps, please. Number one thing, follow your recommended books. Number two thing, follow the guidelines. Okay, like you have opened one chapter, you are going to study that chapter, and you are supposed to prepare your, for example, a test. Number one thing that you have to do is your follow recommending books, recommended books. Number two thing is that you have to follow the guidelines that are written by your either seniors or of any organization, like there are many organizations working for medical students. Okay, so you don't need to worry. Number three, that you have to take your test seriously. Please take your test seriously. Okay, on number fourth is that prepare for your test like you are preparing for your prof exam, like you're preparing that particular topic for your prof exam. Number fourth is that uh, watch videos. Okay, previously in your FSC there was no concept of watching videos from YouTube, but in MBBS your major teacher is this YouTube. Number fifth is that you can make short notes. Okay, you can make short notes of those videos in your own words. It would be easy for you to revise that topic from your own notes written by yourself in your own words. Okay, on number sixth is that you have to keep the past papers by yourself. Okay, like there are again many past papers. I will not mention their names, you will find them in general groups. There are many past papers. Just keep, thing is that you have to keep your past papers by your side. Okay, you have to keep your past papers by your side. You will come to know, after seeing the past paper you will come to know that which topic you have to read keenly, which topic is very important for you. You have to watch the videos, you have to read it from your recommended book must, rather than from reading it from your short book. And which topic or which content is not very much special for you, and if you don't have enough time you can skip that content too. Okay, this is the benefit of your past paper. Don't jump to the past papers after covering the topic. Please keep them by your side when you're covering that topic for the first time even. Okay, then come that revise that topic. Okay, and if you have done the topic for the if you have read the topic for one time, it doesn't mean that you are done. No, you are not done. You have to revise that topic. Number seven thing is that make groups for study. Okay, you can make group with anyone. Okay, you can make group with anyone. This is not FSC or this is not MDCAT where there's a race of marks. Believe me, you are nothing alone in MBBS. You will chill with your friends too, and you will also study with your friends here. As when you come here, groups are formed itself. I'm not saying that go and start forming the groups and start finding the groups, start finding your partners. Groups will be formed automatically with the passage of the time, even very soon. Okay, and again, I'm not saying that you should make a group of 10 or more students. Even you can make a group of just 3 to 4 students, right? But be sincere in each and every aspect with your fellows, because life together should be good. Try to make life easy. Like if you let me give you an example, okay? If you have a test, there are 8 topics, okay? There are 8 topics in your test. Divide them among your group. Each and every person will prepare his or her own topic. On the very next day or in a day or two, sit for merely an hour or 2 hours. Every person will teach. Okay, like he is your teacher. Every person he will teach his assigned topic to his or her fellows. After that, the next will do the same. Okay, it will take hardly very like 2 hours or like 3 hours or maybe less. I must say maybe less because it is combined study. Believe me that I cannot say with surety that these listeners are picking this topic or not, but the teacher who are teaching you, teaching the whole group, will become a master of that topic. I assure you. Okay. After that you have to do revision. Okay, like your test is today, you have to, or tomorrow, you have to revise it. You have to wake up early in the morning, like 2 hours before usual time, and pray, and after that start revising the syllabus. Okay, it will do wonders. Just keep it in your mind, it will do wonders. Otherwise you will, even if you have studied the topic the night before the test, just before the test, you will uh, forget it. There are many chances that you will forget it if you are covering it for the first time, so you have to revise it early in the morning. Okay, after that you are done with your test, and now what has been left? You have nothing to do now, you have to take rest. Just leave the rest of the things on Allah. It is the time of Allah that He will give you the fruit of your efforts, and indeed Allah loves those who rely upon Him, right? Okay, now let's come towards our other topic, that was UHS recommended books. As your anatomy, physiology, and biochemistry are your major books for anatomy, general anatomy. Anatomy also contains further four subdivisions like general anatomy, gross anatomy. For your general anatomy, this is Lycus and UHS recommended book, and a very good book. After that comes this for gross anatomy, BD. I will recommend BD and Snell's mainly. After, you can also opt for other books. I'm not saying that you must have to follow my indications. You can follow the books, but I am saying that these are good books. After that comes the histology. This is like who stand for histology. After that comes embryology. This is Langman's, and this is KLM. I read at my time these two books, KLM and Langman. Langman is very concise book and very beautifully written book. You can also follow it, but for some topics you have to consult for the Langman too. After that comes your physiology. Don't jump to Firdaus. Okay, you are going to be a doctor now. You must have to follow somewhat, because you are a doctor, you are going to be a brand, so you must follow some worthy books too. Okay, so you can become a good doctor. Okay, I will tell you that how to make your Guyton equal in volume to Firdaus, but to retain all of the concepts of Guyton as it is in the Firdaus variant made by yourself. Okay, so I will tell you, I will make a separate video on it, as I don't know that you are perceiving what I am saying और नॉट. आई हैव सेड कि मैं आपको बताऊंगी एक सेपरेट वीडियो में कि किस तरह से आप अपनी इसी गाइडन को यूज़ करके एक फिरदौस का वरियन अपने हाथ से लिखा हुआ बना सकते हैं. मैं ये नहीं कह रही कि आपको एक सेपरेट जो है वो रजिस्टर रखना पड़ेगा. नो, इसी बुक को आप कैसे फिरदौस में कन्वर्ट कर सकते हैं. आई विल मेक अ सेपरेट वीडियो ऑन इट. ओके, इट विल कंटेन ऑल द कॉन्सेप्ट्स ऑफ द गाइडन, बट इसका वॉल्यूम जो है वो थोड़ा सा कम हो के फिरदौस जितना मे भी हो जाए, या फिरदौस से थोड़ा सा ज़्यादा हो जाए. ठीक है, बट इट विल बी फ्रूटफुल. Okay, as you all people are done with your MDCAT, you might be knowing already about shortlisting. We have to do the same thing with your guide. Okay, after that comes this biochemistry. Lipin Code is a major book. There are other books like Mushtaq and Harper's from where you have to cover a topic or more. After that comes your minor subjects for pathology. This is good. Pathoma is a very good book, highly recommended book, as most of the students follow it for their USMLE 2 to pass their fourth year exam, prof exam 2. Okay, medium Robbins is an option, but you have to cover your major subjects first. So pathology, pathoma is enough for you. After that comes the Mudawat. It's Rana. This is Handbook of Behavioral Sciences. And there's another book that is Mini Katsung, which I have not added here. That is for your pharmacology. I hope so that this will be beneficial for you. Thank you very much.